Hi, I'm Benita Dodd, and I am the Vice President of the Georgia Public Policy Foundation. You've seen me at many of our events. You've seen me do some Facebook Live events, but I am so excited to share with you today that we have some help at the Georgia Public Policy Foundation. And Chris Denson has joined us. He had the misfortune of joining us right before state shutdown, a week after he started working with the Georgia Public Policy Foundation as our new director of research and policy. Or is it policy and research? Which way does it go? I'm still getting used to it.
Policy and research, I
Okay,
believe.
there you go, policy and research. And we're really excited to have his help. He has this amazing expertise of almost a decade in healthcare, and I want him to tell you a little about himself. We're so glad to have him on board. This has pretty much been the only way to introduce him because nobody's in the office these days. But I'm going to let Chris tell you a little about himself, and we've decided that we're going to do a five-minute little discussion about a really special slide that he prepared, and I want him to share it with you. But first of all, Chris, welcome on board.
Thank you very much for that introduction, Benita. And I'm happy to be with you today. In addition to the social media audience, we are preparing this brief presentation. But as Benita said, I joined the foundation in early March as the Director of Policy and Research. Prior to that, I had spent most of my career working in healthcare policy, including for a former senator from Georgia. I worked for former Health and Human Services Secretary, and then spent about 5 years here in the state working for a rural hospital association. So with all of that, trying to take that experience and that expertise and help us design some, forward-thinking, market-oriented solutions to dealing with this COVID-19 pandemic that both the state and the nation are facing today.
So yesterday we made a virtual, yesterday being Tuesday the 21st, we introduced Chris to the board virtually since he hasn't had a chance to meet any of the board of directors yet. And during that meeting, virtual, just as we're doing now, I'm up in the North Georgia mountains and Chris is all the way over in Douglasville at the moment, and this is doing great. But Chris posted a really fascinating graph that he'd been working on. And it was interesting in that it explained a lot of what was behind the obviously now highly controversial decision that Governor Kemp has made. You've seen reactions run the gamut. But Chris, I asked if you would help us by sharing that graph and explaining what it is. So if you can pull that graph up and set some background to it and explain how you came up with the data, I think it would help a lot of Georgians understand that this was no foolhardy, short-sighted, or pie-in-the-sky decision that the governor made.
Yes, absolutely, Benita. I'll be glad to share that. And is the slide showing up on your end?
Yes, it looks great.
Okay, fantastic. So the Institute for Health Metrics and Evaluation, or the IHME, in the university, which is located at the University of Washington, they have been one of the most prominent institutes in terms of tracking the COVID-19 statistics in Georgia and across the country and across the world too as well. And so on April 1, we began tracking those projections here at the foundation. At that point in time, we were about 2 weeks into our shelter-in-place order. And so we began tracking the projections that IHME was putting out on behalf of the state. And if you look here at the first column that we have, April 1, you can tell that the peak resource date being what would be the maximum use of resources and personnel in our health system, that was projected to be April 24th. And at that point in time, according to the IHME, we are facing a bed shortage, and that's an overall bed shortage in hospitals of 1,880 beds, and then an ICU bed shortage of 941. And then at that point in time, we also were needing just over 1,200 ventilators in the state. So we were really facing some very scary projections on April 1st. As you'll see at the bottom, we were also, looking at over 3,000 or over 3,200 deaths expected here in the state at the current rate. So on this slide, I'm going to flash forward here to the most recent projection as of publication time, and that was on April 17th. And on April 17th, you'll see that the peak resource date had actually been moved up, and it was retroactive to April 15th. So on April 17th, the IHME was saying that our health system, our hospitals, our providers here in the state, had actually experienced the largest surge they would face in terms of resource capacity. And at that point in time, we no longer had a bed shortage or an overall bed shortage in our hospitals and health systems, and no longer did we have an ICU bed shortage. And the ventilators that were required for our COVID-19 patients were now down from 1,224 to 287. In addition, going back to the total deaths, now they were projected to be 1,369, which is still a serious number, but nowhere near the magnitude of the projections that we were facing at the beginning of the month. And so when you look at these numbers overall, both in terms of the capacity in the system, in addition to the statistics, the projections in terms of death rate, you'll see the picture. And I'm sure Governor Kemp had several different sources that he was relying on when he made his decision to reopen some of our industries and organizations. And we'll get into that shortly. But once you look at the slide, it presents the picture of the overall health statistics and what led him and his team towards opening the state back up.
So basically what you're saying is that the governor didn't just say, well, you know what, Friday looks like a good day to let people start opening their businesses. But it looks like we had some really positive results, and probably a lot of it from the shelter-in-place orders that came into being. So now we have had essential businesses opened all along. Why don't you talk a little about what the governor has said going forward?
Yes, so obviously on Monday afternoon, April 21st, the governor issued a statement regarding his plans to open the state back up. And here at the foundation, the important thing that we are constantly coming back to is that this needs to be viewed as, and in the world of legislation, there is either may or shall. And what the governor has said in his statement is that certain industries on specific dates may open, not shall. This is not a mandate to reopen. And I think that is the most important thing that the citizens of Georgia need to understand as we move forward, that this is not a mandate to reopen. He mentioned several different industries specifically, and I'm sure we'll get into that in a second. But overall, this is not a mandate that anything needs to reopen. In fact, in a lot of ways, this is not different than the way things were before. Citizens should still go to the grocery store when necessary. We still need to focus on flattening the curve and taking restraint before we move towards a full reopening of society, if you will. But the shelter in place, as a matter of fact, it's still in effect until April 30th. Mm-hmm. And the governor mentioned specifically that he would even caution the elderly to remain sheltered in place until May 13th. Now, there's other details that he has promised to release this week, but overall, I think that those are some of the big things that that our citizens need to focus on moving forward.
Okay, well, I know that we're going to have lots to talk about in the months and years to come as we work together. So we're going to wrap this up, but I wanted to have an opportunity for you to share your email address. So if anybody has any questions and wants to welcome you on board to a great state-focused think tank, they'll have that. So why don't you share that?
Yes, absolutely. My email address is chrisd@georgiapolicy.org. And once again, that's Chris, letter D, at georgiapolicy.org.
And I want to thank you all for joining us. I hope that helped explain a little more about what's going on in Georgia as we battle the COVID-19 pandemic. And we look forward to seeing you again. We're going to try a few more of these. This is, quote unquote, the new normal. See you next time. Thanks, Chris.
Thank you.